Hey guys, and welcome to my channel. Today I'm going to talk to you about what postpartum depression is. So the first thing that you need to know about postpartum depression is that it is a form of major depressive disorder. It is not its own diagnosis in the DSM, which is what therapists and mental health practitioners use to diagnose mental disorders. So I'm looking from the DSM-5 today. And there is another edition of it. It's called the DSM-5 TR. And I have one at work, but at home I only have the DSM-5. So the DSM-5 TR doesn't have any differences in the postpartum depression area. Those differences that they made have nothing to do with this diagnosis as far as postpartum depression. So it's okay to still use this for this video purpose. I do want to put a disclaimer that if you think that you are having mental health issues, you really should go get diagnosed or get assessed by a mental health professional, because this video is not therapy. It is just for informational purposes. So that being said, first thing that you should know is postpartum depression is not its own separate disorder from major depressive disorder. It is a form of major depressive disorder. And it's actually called peripartum depression for the specifier. So if you are going to a counselor and they diagnose you with postpartum depression, what they're actually going to diagnose you with is peripartum depression, which basically means it's depression that is brought on during pregnancy or 4 weeks, at least 4 weeks after giving birth. With that, so it's called peripartum because it can happen before birth, so it's not really postpartum. So some women have depression while they're pregnant, and for that reason they would call it peripartum rather than postpartum depression. So just to give you some ideas of what you're looking for if you're thinking that maybe you might be depressed and you're trying to figure out if it's depression or if it's, a hormonal change, which peripartum depression can be brought on by a hormonal change, which makes it a very unique diagnosis because sometimes women can, after they breastfeed, they can just go back to what they were before and like emotion-wise. And the depression is gone. So sometimes it stays longer. It just depends on the person and really what is going on. So that's what makes it so unique, because major depressive disorder, people know if they get diagnosed with that, it's typically like a long life battle of dealing with it. Whereas peripartum depression can come and go with pregnancy, hormonal changes, things like that. There's so many factors. And so it's harder, I think, for clinicians to really I think it's sometimes harder to diagnose sometimes, and I'll tell you why by talking to you about the symptoms of major depressive disorder. But yeah, it can be kind of harder, and it can be hard for people who are going through it to understand that that's what they're going through. So hopefully this video helps you clear some things up. Let's just go over what the peripartum basically is, okay? So it's a specifier of major depressive disorder. So like I said, it's not its own independent disorder. It's part of major depressive disorder. It's a specifier of it. So actually what they'll diagnose you with is major depressive disorder with peripartum onset. So what that means is you could still have major depressive disorder after your hormones level out again. You actually have a higher chance of getting diagnosed with this again with every pregnancy or just later in life. So that's why it's kind of like, but then some people get diagnosed with major depressive disorder and they don't get diagnosed with anything else. So ever again, they never have any other mental health issues. So it's kind of hard to know sometimes for people, for, patients basically, what this means for you, basically. What a psychiatrist is likely going to do is recommend you go to counseling, and also probably give you some kind of antidepressant. But if you're breastfeeding, they probably get you one that is safe for breastfeeding. Or I've known women who have had to choose whether they want to breastfeed or take their depressant medication. And if they choose to breastfeed, then therapy is especially important because then they have to learn how to cope with the feelings of depression, and doing activities that help mitigate their depression. So, something that's interesting that's in the DSM under peripartum onset is mood episodes can have their onset either during pregnancy or postpartum, although the estimates differ according to the period of follow-up after delivery. Between 3 to 6% of women will experience the onset of a major depressive episode during pregnancy or in the weeks or months following delivery. 50% of postpartum major depressive episodes actually begin prior to delivery. Thus, these episodes are referred to collectively as peripartum episodes. Women with peripartum major depressive episodes often have severe anxiety and even panic attacks. Prospective studies have demonstrated that mood and anxiety symptoms during pregnancy, as well as the baby blues, increase the risk for a postpartum major depressive episode. Sorry. The first thing I'm gonna go through is the symptoms of major depressive disorder. I'm gonna try and make it not so boring, but 5 or more of the following symptoms have to have been present in the same 2-week period, and must be, obviously a change from previous functionings. One of the two must be at least a depressed mood or loss of interest or pleasure. So the first thing, it could be, doesn't have to be, but could be any of these 9 symptoms. Depressed mood most of the day, nearly every day, as indicated by either a subjective report, which basically means how you're feeling, what you tell me as far as how you feel, or observations made by others. So maybe you didn't say that you feel depressed, but other people can tell that you're not what you were before. The second one is markedly diminished pleasure or interest or pleasure in all or most of activities most of the day, nearly every day, as indicated by either subjective account or observation. Number 3, significant weight loss or when not dieting, or weight gain, or decrease or increase in appetite nearly every day. Insomnia or hypersomnia nearly every day. I'm sorry. I have this cough. So anyways, just trying to work through it. Okay, so hypersomnia is when you sleep too much. It's the opposite of insomnia, basically, in case you didn't know. Psychomotor agitation or retardation nearly every day. So basically observable by others, not merely subjective feelings or restlessness or being slowed down. So other people have to be able to see that you have psychomotor agitation, which means that you are maybe catatonic a little bit, maybe not moving, maybe not getting out of bed like you used to, not just moving slower, but just hardly moving, basically. Fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive or inappropriate guilt, which may be delusional, nearly every day, not merely self-reproach or guilt about being sick. Number 8, diminished ability to think or concentrate or indecisiveness nearly every day, either subjective or observed by others. Recurrent thoughts of death, not just fear of dying, recurrent suicidal ideation without a specific plan or a suicide attempt or a specific plan for committing suicide. So that's all. So how diagnoses work is that there's a bunch of criteria you have to meet. So this is all under criteria A, which is to have 5 of the symptoms that I just listed. Okay, and at least one of those symptoms need to have just something to do with your mood, depressed mood, or a loss of interest in your activities that you usually do. The next criterion is the symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The episode, letter C, the next criteria is the episode is not attributable to the physiological effects of a substance or another medical condition. Um, it also notes that responses to significant loss, such as somebody has died or financial ruin or any like serious loss, disaster, whatever, obviously is not a major depressive disorder, but grieving. Moving on. D is the occurrence of major depressive episode is not explained by schizoaffective disorder, schizophrenia, basically any other thing. And there has never been a manic episode or hypomanic episode, which basically is ruling out bipolar disorder. So those things you don't really need to know or care about that much. That's more for your mental health professional to look at. But when you're thinking about the symptoms, okay, so this is why I said it can be hard for a woman to understand if they are going through depression or if it's just like a hormonal change, because some of these things are just things that a lot of women experience after they give birth. Like I've heard, I think my nurse told me after I gave birth that like usually around day 3, women are usually more emotional. And of course, right on day 3, I was like crying like a baby and just very distressed. So certain things are normal depending on the hormones, but if it doesn't go away, if that distress and that crying or that whatever it is that's different for you doesn't go away, then that's a cause to be concerned, right? So my postpartum looked up and down and things like that. Some people have really lows. Like I had a cousin who had postpartum depression. Some people can go about their daily activities normal. Okay, so it really just depends, and that's why it's kind of hard. So some of these things like a diminished interest or pleasure in all or most activities nearly every day. I mean, if you just had a baby, you might not be as interested in some things that you used to be interested in. It depends on what those things are. Like partying may not be an interest to you. I don't know, it depends. So weight loss, obviously, you're gonna have some weight loss. I think if you obviously dramatically lose weight, then that's a cause for concern. But if you're breastfeeding especially, you're gonna have some weight loss. Here's the thing that would be really hard, I think, to figure out if this is depression or if this is postpartum. It's the fatigue part. Fatigue or loss of energy nearly every day. Well, if you have a newborn, you're up throughout the night feeding them, changing them, so you're gonna be fatigued regardless. So that one is really hard. Like I would say if you're having 4 out of 5 of these symptoms and the fatigue thing is kind of just like up in the air, then you probably should go see a mental health counselor, just because you have enough of the symptoms, and fatigue is not something that you're really going to be able to know if that's dramatically different due to depression or if it's just due to being a parent now to a newborn. Diminished ability to concentrate or think, again, could be due to fatigue because you're not getting enough sleep because you're up all night with a baby. Yeah, so insomnia, obviously, again, up and down. So these are things, that's why I say it's so hard to figure this out sometimes for people, because a lot of these, especially the ones that have to do with sleep or energy, are kind of just come with being a new parent. So I would say if you feel like you're having a lot of these other symptoms, you should still go see a mental health counselor. Obviously, if you're at all concerned about your mental health, you should see a mental health counselor. And it goes on to talk more about different statistics. And some women it's very, very rare, but some women can have hallucinations and kind of psychotic episodes as well. But that's very rare. And that's not what this video is. So anyways, I hope that this helps you a little bit better understand if you were recently diagnosed with postpartum depression, or peripartum, or major depressive with peripartum onset, and you didn't really know what that meant. I hope this video cleared things up for you a little bit. As far as that goes, if you are wondering if you have postpartum depression or peripartum, then you should definitely go see a mental health counselor. And I hope this video helped answer those questions for you a little bit. I am not a doctor, but I am a counselor, and and I am a mom, so I do know a little bit about the moods that you go through during postpartum period. So that is why I felt like it was important to make this video and help people understand. So like I said, some things can just be due to hormones, but sometimes those feelings that you have, sometimes they don't go away. And when it doesn't go away and it starts to impact your bonding with your baby or taking care of yourself or taking care of your baby, then you should be concerned and go see a professional for some help. And I hope this helped you, and don't forget to like and subscribe. Thanks, bye.